Hello, my name is Lisbeth Trevino. I work at the Department of Molecular Sciences at the UTRGV School of Medicine. I work under Dr. Ramirez Correa, and I'll be presenting on the effect of IGF1 on post-transitional modifications on a model of diabetes-induced cardiac hypertrophy in H9C2 cardiomyoblast cells. I'll be going over some background. Diabetic cardiomyocytes alter their post-transitional modification levels, especially in O-gluconic and phosphorylation. Insulin-like growth factor, IGF1, is a peptide known to induce favorable cardiovascular effects. In patients with heart failure, here we focus on the targets where IGF1 will be acting as a potential intermediary in DCM treatment. Methods. H9C2 cells were cultured in DMEM 10% FPAs at 80% confluence as a cellular model of diabetes and cardiac hypertrophy. We used a high glucose medium at 30 millimolar glucose in the presence or absence of 10 micromolar per liter of IGF, high glucose and high glucose plus IGF1. As control groups, we use cells cultured in low glucose DMEM, glucose 5 millimolar in the presence or absence of IGF1, low glucose and low glucose plus IGF1. After 48 hours of incubation, cell area was measured, and then proteins were extracted to analyze PTMs patterns by Western blot. At first, we corroborate the hypertrophic effects of a high glucose treatment and or IGF treatment by the culture. In those conditions, we found that either IGF or high glucose treatment induced hypertrophy by measuring cell area compared with group treated with low glucose concentrations. For transitional modifications, we measure the level of O-gluconic and cell of the 4 groups. Here we found that IGF1 induce a decrease in the PTM in the group treated with high glucose, almost to the levels found in low glucose group. Regarding the effect of IGF1 on phosphorylation levels, we studied tyrosine and serine threonine phosphorylation. In the first case, we found that IGF reduced the level of phosphotyrosine compared with low glucose and high glucose groups. And for the phosphorylated serine threonine, we saw that there is a trend that IGF induce a recovery in the phosphorylation state in the groups high glucose plus IGF1. Conclusions. These results show that IGF1 signaling pathway stimulation lowers the levels of cardiac proteins, O-gluconic and tyrosine phosphorylation in high glucose. In contrast, the phosphorylation of serine and threonine resides in high glucose plus IGF1 group seems to be similar to low glucose group. In future experiments, we will measure global changes with tandem mass tagging, quantitative proteomics, and assess kinase activities and their networks with bioinformatic algorithms such as post-transitional modification database and kinase substrate enrichment analysis.